Physiotherapy, I think, has probably been treating trauma without knowing it for a long time. An expression I have is, if I'm doing any mentoring and teaching to my colleagues, is always question what is going on in a treatment session. And I am just continue to be astonished at how much, after 30 odd years, I still I laugh and go, wow, that's going on too. If we're doing a manual therapy technique, we might think that we're moving some vertebrae around, we're mobilizing soft tissues. So when we're moving tissues, what are we doing about communication through the body? What are we doing to free up flow of information through the body by using our hands? If we're working on muscles in the back, quadratus lumborum, for example, we actually have the ascending and descending colon attached to the front of these muscles. Your kidneys are attached to the underside of the diaphragm and to quadratus lumborum. So when we're moving tissues, what are we doing to these other organs? Now, if we're holding tension from trauma, then surely there's got to be some influence of manual therapy on unlocking in some way those tension holding patterns, and so unpackaging trauma. And it's for this reason that my approach to treating trauma is not just through somatic work and nervous system work. One of my teachers has more recently updated an expression about trauma and said trauma is not what happens to us, but what happens inside our bodies in response to what happened to us. And he's more recently added, in the absence of a benevolent other. If we have somebody present with us as we're working through, and they have a calm and regulated nervous system and can be attuned to you, that does something very, very powerful in our nervous system, and so is an important part of healing trauma. Safety in the nervous system is really important when we're talking about trauma. And it's our job as therapists, this is a safe space, should be a safe space. And if people come in and go, oh, I immediately feel different when I walk in, I'm going, well, we got something right then. Yeah, because the whole environment is about making sure that you feel safe. You've got no chance doing anything else. If you're starting from a place where the patient's kind of going, is this, I don't know about this, I'm not sure about this, well, you're on a hiding to nothing. We're very fortunate as physiotherapists to always have a long time with patients. You know, poor old GPs have 6 minutes. I don't know how they do that. You know, we have, most of my patients, I have spent an hour. And certainly we're used to spending time chatting and building and forging a relationship. And for many people, this is a safe space where they can come and they feel trust. Now that's an important part of healing trauma. And if you're going to allow people to make contact with your body and to work with you, so through thoughts, emotions, through stories, then I think our experience as physiotherapists spending time with people really positions us well. It's because there's so much more going on than we realize that I think that physiotherapy is a very, very powerful discipline to work with trauma. Hi, I'm Roger. Thanks for watching the video. Hope you enjoyed it. And don't forget to hit the like and subscribe buttons.